Ladies and gentlemen, welcome to this week's episode of What the Health Just Happened, where we talk about all things healthcare, community, business, and life. The goods, the bads, the ups, the downs, the lefts, the rights, and everything in between. We are so fortunate to have on a variety of guests way smarter than we are to share their industry expertise on all things, we'll say healthy versus not healthy in their industry, whatever we find. Today, Guardian Pharmacy, that's the name of the company, right? We have three people in studio, two of which are sitting on the microphones. Jessica Ross, tucked in the corner. Shout out. Hey. We'll see if she won't chime in at some point. Director of Sales and Marketing. She calls herself Director of Fun. We have President at Guardian Pharmacy Khristy McClelland. Yep. I said it right. Yep. And let's see if I can't butcher this one. Director of Customer Service and Relations, Jerry Talarico.
Perfect.
Did I do it?
Absolutely perfect.
We said everything correctly.
Yeah.
Welcome to What the Health Just Happened. We're excited to have you here. Let's party.
Great.
Where do we want to start? You want to start business or nonsense?
Nonsense?
No, that's a no. So business out of the way so she can explain, get the boring out of the way, what the company does.
I love beforehand we cut it up. We kind of get you guys comfortable if we can. So what is Guardian Pharmacy? I've got a ton of notes here, but what's your version of what Guardian Pharmacy does?
We're a long-term care pharmacy here in Jacksonville, and we help people have better lives with pharmacy services, prescription services, and everything else that we offer.
Everything under the sun.
And long-term care is skilled facilities, rehab facilities, assisted living. And assisted living, if you don't know it, there's one every mile and a half. On this road right here, there's probably 6. That I can name. There's Wyndham Lakes, I know, across the street. Brookdale, St. Augustine. Brookdale Manor Central, Crown Point.
There's a lot.
There's a lot. Augustine Landing. There is literally 5 within a mile of
right here next.
Right here in Old St. Augustine Road.
That's a great thing you did. So when LTC or long-term care, some people think of long-term care insurance, but long-term care facilities or residences are a combination of memory care, assisted living, skilled nursing, CCRCs. Does that fall under that umbrella?
Yep. Right.
So Guardian Pharmacy, you all are meeting with these places to do what?
They both look at each other. So basically, we're the middleman. So instead of having to go get your medications at CVS, Walgreens, Walmart, whatever, we bring your medications to you. So we're that instead of going through those different entities, the nursing staff have to say, oh, we need a refill on this. They just go straight to us where we have our own medications and we distribute them to these facilities.
We had talked on a phone call Monday. What's your background? I asked, how did you end up doing this? Because I would say this is a very specific niche.
Yeah, it's a small segment of pharmacy. So when we moved to Jacksonville, my husband was interviewing for a nuclear pharmacist job, and he told them that he didn't want to be a nuclear pharmacist, but that I might. So I ended up taking the job. So I was a nuclear pharmacist for about 10 years. And then the company that I worked for started this long-term care pharmacy. And
I'll be honest, nuclear pharmacist, I'm actually
glad that he's asking that because I've known that background and I've never known what it is, but I feel stupid asking it. So now that you're asking it,
I got you covered.
Easy. Because it's nuclear pharmacist. She's you're nuclear.
So
you got to really dumb it down for us.
Okay. So you've heard of people having a heart study?
Yeah.
So we would make the radiopharmaceuticals that people would inject, and then the cameras could see what the heart's doing. You can see the function of the heart.
So contrast in a hospital, the radiology department is putting contrast in.
This is different. So it is similar. It's just a radiopharmaceutical. So you can get different measurements out of different organs. So you can look at lungs, bone, heart, thyroid, things like that. So
exactly.
Jess, did you know that? Jess, did you ever know that?
Knowing sound effects.
I know. I didn't ever know that either.
I was actually in the same boat as you. I'm like, oh, nuclear pharmacy, you're so smart.
I've just been she's worked at nuclear pharmacy. That's what she did, and I didn't ever know what it meant.
Yeah.
We'll go. I still don't really know. I'm gonna have to Google it after this. Fair warning. Exactly.
The funny thing about that though is, so you make all these syringes, all the doses are in syringes, and then you have to put them in lead-lined containers to transport them to the hospitals or the physician offices. And the little lead-lined containers are called pigs. So every morning you're there, you're making all the pigs that are going to go out on the run. So,
my goodness.
Yeah.
Okay, we'll go back to Guardian Pharmacy. You're celebrating 20 years this year.
Yes.
Is that okay? So someone do the math on that. What year is 20 years ago?
Well, it's
2005.
2005. Got it. So,
We were still in college. That's why.
yeah, correct. A lot of cloudy things happening in college. So 20 years ago, you were in nuclear pharmacy, started this location in Jacksonville. So Guardian Pharmacy is all over the United States. I got a map here. Where are they located and how excited are you? 20 years is a big deal.
Yeah. We were the second pharmacy officially for Guardian. Now we have about 50 pharmacies across the state, the states. And we were the second ones, got started, and
In your role, I'm going to come back to you in a second. I know you're chomping at the bit. I can see your role. So you were an actual pharmacist, right? And now you're essentially running a business.
yeah, so a pharmacist by training, that's what I went to school for. But in the nuclear pharmacy, I ran the pharmacy there. And then through various acquisitions, I ended up being kind of an area manager over from North Carolina all the way down to Florida for the United States.
What's harder, making pigs, which is the term for the lead flame, or managing people?
People.
People?
Yeah. It's way more interesting as well.
Way more entertaining. So, Jerry, I love this story too. You've been there almost 12 years.
Yes.
And you started, what was your first role with the organization?
As a fill tech, so I filled the medications that go out to our customers.
You're essentially in a warehouse just filling medications. This facility needs these medications. You're putting them in bottles. Here you go. You're off.
Right. Yeah, that's correct.
What was your background?
So my background, this is how I got started in it, is I wanted to be a pharmacist. Started going to school for it, and then they said, like, I had the grades, took the PCAT, did great, and then they didn't accept me into the pharmacy school because they said you have no experience. So like, they're like, do you really want to do this? It kind of sounds like something that was like a last minute, like, you have the credentials, do it. So I had to apply to a different pharmacies. I got a call from Guardian, which was Laura, who is the director of operations. She hired me to work as a fill tech just temporarily. And then I started doing it. And then it was like just about a year later that a new position, they had never done it before, which was the position that I ended up being after was, I think it was customer service liaison or something like that. So they created these positions, only 4 of them at the start. And they said, basically, you're going to go on, you're going to be the liaison between our customers and our pharmacy. We want to try this out. We want to try this hybrid rollout. So I was like, yeah, I'll try that. So then I ended up not going to pharmacy school. Loved doing it.
Who needs more schooling?
Right.
So this kind of speaks to the culture too. I asked about this. What is a company's culture like? So you're going into long-term care facilities. There's other stuff too. I do have to say this. Assisted living and memory care, mental and behavioral health, post-acute and long-term care, hospice care, and PACE programs. We'll go back to PACE programs in a second. You've been there for almost 12 years. I feel like you met someone pretty relevant in your life.
Yes.
At the company.
So that was 12 years ago. My wife, she was working in data entry at the time. I was working at Phil. So we connected. She has a funny story the way we connected because like I was trying to be smooth. And by being smooth, what I did was I was like, she was also studying for the PCAT. So I was like, hey, like and she always like says like your father introduced himself and gave me his email address and was like, let's link up. Here's my email address. And I was like, I don't know why I would have been like, here's the email address. Like we were in like 1995, like we didn't have cell phones or anything, but I was like, here's my email address. So then we started studying together, which led to us dating. And now we have 3 children that are 5 and under, and we are still working well together, actually.
Super secret dating.
Super secret. We did it secretly. We did it secretly for almost 4 years because both of us agreed. We were like, we don't want this to be, if it doesn't work out, what we didn't want is anyone judging of like either side of us. Like, we're just sleeping with other coworkers. So I think that was it.
Hashtag healthy.
That was honest. It was honest. So we did. So we were like, all right, let's keep it secret. And then it started being found out. Like people were like, hey, we saw you guys at the movies. And we couldn't post. I actually had a completely fake girlfriend that I made up. It was like, honestly, a name that I still remember, which is
not
crazy.
healthy.
Right. Now that, yeah, but I had, because people would be like, what were you doing this weekend?
Was it Susan?
No. This is great. But I had to say this because people would be like, what did you do this weekend? And it'd be like, I'm with my girlfriend. They're like, oh yeah. So then it was like, I have to come up with a name. Like I can't be like, never say her name. So made up a name, and then I actually had another friend just in case needed, was like on standby. This girl that I know that was on my
This is an elaborate plan, by the way.
It was very elaborate. But then we were finally able to come clean when we got engaged, and we were like, all right, now we can.
But he didn't. Now, he was very mean to me when he got engaged. So we had gone to visit customers and we were driving back. I think I was in the back seat because we had somebody else there. And he tells me he's getting engaged. And I don't even know he's dating somebody.
Still the same person.
And I am just like, oh my gosh, who is this person that Jerry has picked out? Because I'm not sure she's good enough for him.
Oh.
And so I was just
That's very
wrecked.
sweet.
I was worried. So,
And
then
it's
so
still,
happy.
at that point, she still thought I was dating this fictitious person.
Yes.
Made up human. I love these stories.
Yeah.
Okay, man. Well, let's put guardrails back up. You said something. You were going to meet with a customer. So, who is Guardian Pharmacy's customer? I know we had talked about long-term care facilities. Who else?
So we have the people who run the long-term care facilities, executive directors, nursing, people like that. And then really the residents who live there. So the actual patients who live in the communities are our customers. So those are the ones that we're trying to help improve their healthcare outcomes and deliver medications for. So
I like to give. You're going to chime in, Trey?
Yeah, what's the delivery process like? How does that go? Is it a van? Is it like, I know that's weird, but I'm curious. What is that process like?
we have a very detailed process for how we deliver the medications. So they're all hand packed, not in bottles, but special packaging. And then they're reconciled to a packing list. And then we have a local courier that will deliver them out and, you know, sign
And they are
for 'em.
unmarked. So we do unmarked
Yeah.
cars.
Right.
So they're just regular cars on the road.
Yeah.
You never know.
Cool.
So you outsource the transportation to another organization locally.
Mm-hmm.
I like that too. How do you create other jobs? Could you bring it in-house maybe, but is it worth it? No, I think you're, getting someone else.
Speak on that. Yeah.
We like to focus on, what we do best.
Yeah.
And so we're not a logistics and transportation company. So,
Love that.
Yeah.
Going back to customers, I always try to use specific examples. I talk about my Grandma Jane and Grandpa Bill often. They've moved on since then, but they lived in a CCRC. So you're dealing with 2, sometimes even 3 customers. You have the actual location, the residence, whether it's executive director, director of nursing, and then a secondary patient or client is the actual resident or patient. Grandma Jane and Grandpa Bill will say. Right. So you have to win the facility to have that relationship in order to walk on those doors. And then you have to win the family.
Right.
Who else? I think this is, you could probably hit on this. It's not just the resident. Who else is involved in the decision making to go with Guardian Pharmacy?
The family is hugely involved.
Yeah.
They're honestly more involved than the resident themselves, I would say.
Yeah, adult children, spouses,
Right.
power of attorneys.
Right.
I think, too, for the adult children, I think you bring up a good point, and that comes to our delivery process and what we do best. I mean, we're the generation that, it's either our grandparents or our parents that, are living in these facilities. And we're also working. We also have young kids. So we're trying the hustle and bustle of getting from our jobs, pick up our kids from school, get them to sporting events, and is stopping at CVS or Publix or whatever, retail pharmacy on your way home to then go bring it to the facility to make sure they have it in time when that can be eliminated. Use Guardian Pharmacy Jacksonville and get those items delivered for you and take one thing off your plate.
Good name plug right there on the
Great
company,
name
by the way. But that's a great example. I look like my adult children who also have their own kids who are probably helping out often. How do you make their lives easier?
Right.
And that's part of the services that you're
I
providing.
mean, do you want to spend your time running errands for your family members, or do you want to spend time with your family members?
I just want to surf, fish, and golf.
That's
That's it.
So I always use this for when I do speak to families that are questioning it. I'll say, so imagine that you're like, oh, no problem. It'll be a great excuse for me to visit mom or dad. I can go stop at CVS whenever they need meds. I can grab them. Not a big deal. And I'm like, so at first you had a plan, and then all of a sudden you get a call on Monday. Hey, mom's out of her furosemide. No problem. I'll stop at CVS. I'll get it. Then on Tuesday, hey, we forgot to mention she also needs her spironolactone. And you're like, no problem. I'll get that. Then you've now gone twice already, Monday, Tuesday. Now all of a sudden Wednesday, they're like, hey, we completely forgot she needs her polyglycol. Can you also No problem, I'll get that. And now it's become you have made mom or dad now this, I have to go do this. I have to go pick up these meds.
Then
and bring
you
them to
dread
them.
it. Yep.
Right. Then you're dreading it, as opposed to like the point of going there is to be able to enjoy it. Instead, it's now become a job for them to have to go get these medications. And a lot of people are on 15 to 20 medications, the geriatric, people are on that, or the population. So then you're having 15 to 20 medications refilled throughout the month at different times.
And not to mention emergencies and antibiotics
right.
and things like that in the middle of the night. So.
I got to ask Trey, do you know what furosemide is?
Oh, no way, dude.
Lasix, yeah, water pill.
There you go.
So let's talk. That's a great transition to med management. You look at a certain population; they're taking a ton of medications. They may be taking duplicate medications. Are you all assisting with that? Like, hey, you're only supposed to be taking 15 pills. You got 30 in your pill box here.
I think that's one of the things that we have been able to introduce into the industry is the interventions that our pharmacists do on behalf of patients. So we actually track clinical outcomes and exactly what you're saying. We are looking for allergies, duplicate medications, duplicate therapies, drug-drug interactions. And honestly, when people move into, particularly assisted living, I think our pharmacists are sometimes the people who get the first look at all the meds they're taking, because before that, they're at home and they're going to this specialist, that specialist, this primary care, and they're all prescribing. But, when they get moved into a facility, that's when you see all of it. And so we've had a lot of successful interventions.
I always think about the stress and anxiety that comes for the residents moving, right? That's a burden in and of itself. You're almost the first line of defense to make them comfortable, make them feel safe. What does that look like? Is that part of your role?
So if it needs to be, I can certainly meet with the residents' family members or with the resident themselves. Generally, that's the salesperson that when they're going into these facilities, that's introducing them to us. So I would say my role is not really that. I'm more to make sure that our services are being upheld with the rest of not only the residents, but with the staff that needs them, if they're getting things timely, if there's any issues, to be that ear in their facilities. Because I'm in a facility, I'd say 90% of the time. I'm in a facility talking to whether it be residents, staff members, owners.
You're going door to door. How many, let's say, facilities, residents, it depends what term you want to call it, right? How many are in Northeast Florida? 100?
Our facilities that we manage, we have, I think, 120.
About 120. We serve about 5,600 patients throughout
Northeast Florida. Is this
Florida.
Duval, St. John? Is it the big 5 counties?
Yes. Big 5, yeah.
And that's similar. So Guardian Pharmacy across the U.S., if they're in one market, they're probably servicing multiple facilities.
Right.
Who are, kind of a two-part question here. Who are good referral partners? I think I know the answer to this. I used to live in this world, by the way. Referral partners, and then just good partners in general in the community to be aware of Guardian Pharmacy.
I'd say the physicians. So physicians groups are great referral partners, especially if we're doing a good job at making sure that they're getting whatever they're prescribing immediately. They're going to obviously want that over, I send something to CVS. Can we make sure we somehow get that logistically to a facility? And then another referral partner, I'd say anybody like rehabs. So there's different places that go into them, like...
I think anyone in the industry really is a referral partner. So your home health companies, hospice, mobile providers, that could be cardiac, that could be podiatry, that could be dental, that like Jerry said, obviously the practitioners. So really anyone that's servicing the senior population is really a referral partner. I go to a lot of marketing and networking events, and even people who work for local magazines or real estate agents, bankers, they come to these events because there's so many seniors that, whether they're selling a home or that however they're being touched, there's really an opportunity for us to work together to help them.
You said a couple that jump. One is like home health care. That's one that sticks out to me, whether it's skilled or unskilled. I was like real estate agents. They know when someone's selling a home and downsizing.
Right.
Mm-hmm. It's a shockingly good referral source.
Right.
The physicians group, I didn't even think about that. That's probably the number one.
That is our number one, I would say.
So what's a good partnership look like there? Like if there's a physician group, maybe you aren't working with, man, they're a great partner. We'd love to work with them. You can say specific names, but what does a relationship like that look like?
So the relationship that I have with them is when I see them, if they're honestly just saying, hey, is there anything that you've had any snags with or you need any help with? because a lot of times they'll go into a building that doesn't have us as their provider, and then they'll say, you really need to get into this building. So it's great for us. And then vice versa, if we're with a building that has a pretty poor physicians group or they don't have a designated physician group, we have issues because then we're reaching out to 5 or 10 different physicians to get refills. And we could be just having one physicians group go in there. And now it's a lot more seamless for us to get those refills, get clarifications and things like that.
Mm-hmm.
I go to, right, EMR. How's the communication amongst, so you have Guardian Pharmacy, facility location, family, physicians. How are we communicating with one another? Are you faxing? I'm always fascinated how many faxes are still sent.
Fax machines.
Still fax machines. How? I know. I think I was watching a show. It's stupid, but they were like, fax machines are such a dead technology, and I was like, in my head, I'm like, it really is. But not in healthcare. It's still thriving.
Yeah.
And we still do use fax machines. We actually just came out with Guardian Note. There's a little plug there, but Guardian Note is our way of, it's almost like a text communication style that you can send messages as well as picture of prescriptions through. But it's nice is that it links, it's almost like a group chat between all of the pharmacy and the community. So we put as many as they want to put into this group chat, as many as we want, which we want most of everyone. So if somebody has a question, it's like a quick text message. Hey, can you tell me where Mrs. So-and-so's medication is? Or can you please stat out Mrs. So-and-so's medication? It goes to everybody in the pharmacy as a message, which is awesome because it's in our era that we're in where everyone texts for everything. Nobody likes answering the phones. I've always said that people are allergic to phones because it's like nurses will be like, we needed this medication stat and you guys didn't stat it. And then I'm like, who did you tell?
Right.
Well, we wrote it on the fax, and I'm like, the fax that goes triaged into possibly seeing 5 hours later. Like that's not, and I say this till I'm blue in the face. I'm like, listen, like faxing, great, but it's not going to be seen timely as if you call, or now, like I said, they're allergic to phones, so nobody told anybody. So we use this text system, Guardian Note, which is a great way to do it.
And it's HIPAA compliant, and they don't store photos on the phone. It's all in the app. So
you said something too that's worth mentioning. This is all HIPAA compliant. That's very important in this specific industry. So if you look out, we got a couple minutes till the commercial break. Let's say 3, 5, 10 years from now, what is a healthy improvement in your industry you'd like to see? Maybe it's already happening. Maybe it's something that sounds ridiculous, but like, what's a healthy improvement in your space that you'd like to see?
To me, it's communication. I mean, if people could adopt that, because that's oftentimes, I think, where things get sideways for residents is people aren't, sending us the right communication. They're not asking for the right things, and it can kind of limit services sometimes.
I think too, technology obviously has come such a long way, and we have all these amazing tools. But to your point in talking about it, we're still using fax machines, right? So in an industry that's come such a long way, I think, sometimes our healthcare industry, especially in the senior segment, is still so far behind. So just kind of utilizing the tools that exist to get everybody, on the same page, which we strive for, and we really do in a lot of different manners. But there's still so much room for improvement, I think.
Anything you'd add to that, or something completely separate?
Something similar where it would be you can see in real time. So like my 3 kids, we have a ProCare app where we can look and see what our kids are doing. Like it tells you when they're having bowel movements, all that. Like so. Like,
when was the last bowel movement?
That's part of it when you go through the medications. Right. No, but because so internally the staff, they can see when the person took their medications. I think the next step is then a family can see that. Because wouldn't that be a huge sigh of relief as you're like, oh, great, mom took all of her medications today. Great. So, and I haven't seen anything on development with like that, but I think that is a next step. Because I know personally I would like it. Like, I mean, I know when my kids are doing everything, but if I had a loved one in assisted living to know, hey, they're going to activities. They went to activities today. Okay, great. Instead of, a week later being like, oh, by the way, mom missed 3 medications because she refused them. And you're like,
that's good. Yeah. That's good. Jessica Ross, Khristy McClelland, Jerry Talarico. Did I say it right again?
Say that again. Man. Great.
Guardian Pharmacy. That's what the hell just happened. Welcome back to the second half of What the Health Just Happened. Good news is, if you're catching this on the radio station, you missed the first half, you can catch the whole thing on your favorite podcast or YouTube under What the Health Just Happened. First half, we have 3 representatives from Guardian Pharmacy: Jessica Ross, Khristy McClelland, and Jerry Talarico. Did I say it right?
Oh, again,
Right again.
Very fun conversation. We laughed a lot more than I anticipated. Guardian Pharmacy is working with long-term care facilities, helping with med management, filling prescriptions, families, etc. Very interesting conversation. We'll probably hit some more of that on the second half. Healthy or not healthy?
Yeah.
You ready?
Do it, yes.
Ready.
Healthy or not healthy embarrassing your kids?
Healthy.
Healthy.
I think so.
100%.
Healthy or not healthy dating a coworker?
Healthy.
Healthy.
Oh, okay. Healthy or not healthy the music we listened to growing up?
Not healthy,
Not
but it was
healthy.
fun.
Not healthy. Healthy or not healthy fax machines?
Not
Not
healthy.
healthy. Far from healthy.
Not healthy.
Healthy or not healthy managing people?
Healthy.
Healthy? Oh, golly, I'm so over people. I'm not kidding.
Not healthy for those who are managing them, but
Are you tough to manage?
no, I'm actually an easy manager. I feel like from my team, they'd be like, he's very easy boss. Like I don't expect much from them. Just kidding.
Healthy or not healthy? You can both answer this. The Jaguars' upcoming football season.
I'm going to go with healthy.
Cam
Let's
Little,
hope.
very healthy.
Fingers crossed.
The rest of the team,
You're
I'd
nervous.
say nervous.
Nervous.
I'm nervous. It was
Okay.
I mean, just to go off real quick.
Yeah,
Rob.
let's go. Let it rip. Let's go. Let's go.
So defense was not confident even a little bit. I think they looked bad against the second team of the Steelers. Offense, I think they struggled as well. I know a lot of people were like, no, they did fine. They didn't look great again against the second team defense in the Steelers. So the only thing I walked away from that game was Cam Little is a monster.
This guy talking about football. He got
You
really
didn't know
excited
it was.
there.
We changed it into a sports podcast
I
today.
bet-
Let's
hey,
go.
Be careful. Be careful. We'll go back to that. Trust me. That's all I want to talk about.
We can talk sports more.
Healthy or not healthy, 20 years in business.
Healthy.
That's a big accomplishment. 20 years doing something consistently, that's a big deal.
Yes.
So let's talk about that. When is the celebration? Where is
Yes.
it? What's the point of it?
Yes, love it. So it's going to be September 11th from 3 to 5 p.m. We're doing pizza and Prosecco at the pharmacy. Love a theme.
Healthy.
Healthy, super healthy. And really the point of it is to celebrate just that. I mean, we've been able to work really hard, and 20 years in business is worth a celebration. So would love to invite anyone in the industry, partners to come and join us, our customers to come and join us, really just to see what we're all about. So there are some people that have worked with us for 20 years that have never walked in the pharmacy. Some that when they do, they're shocked. They think, medications are one place and staff is somewhere else. They're amazed that everything is under one roof. So
Everything's
it's pretty
everywhere.
cool. Yeah. You guys want to come? We'd love to have you.
I'll look at the date. I do like to, when we have a guest on, if they have something coming up, we try to go to as
Yes.
much as we can and support them. But so September 11th, 3 to 5, you said?
Yes.
And what's the address? Can you share that?
Yes, it's going to be at the pharmacy. So that's 8001 Belfort Parkway,
Okay.
Suite 160.
Got it. Who are you excited that's going? Do you have a list of people confirmed?
Yes. So we've sent out our some invitations, and then our account
Invitations?
invitations. Correction.
If I didn't know you for years, I would have said
I know,
that.
it's okay. I can take it. So Jerry and his team are kind of handing out invitations and flyers to the community staff members, and then we've kind of sent invitations out to some industry partners. So those have started. I'm not particularly excited for anyone. I'm excited for everyone.
There you go.
And just the event in itself.
Well
What a
played.
sales.
That's a wordsmith right there.
Oh my God.
Truly.
You could tell she's a director of sales.
I'm a
what
hype
your role
girl. I'm a
I was
hype
going to say
girl.
individual people.
Yeah.
So
Eric Ross. I'm excited for Eric Ross to go.
20 years. You've been there almost 12. What changes have you seen? I mean, it's if you want to chime in too, just let us know over there on the couch. But how many changes in the industry, Guardian Pharmacy specifically?
Guardian Pharmacy, we've grown an exponentially amount since I've been there.
Yes.
Probably 6 times the size of when I first started.
Wow.
Changes in the industry, I'd say EMAR is probably the biggest change, because when I first started, there was no electronic MARs. So EMAR is electronic MARs, where they're recording everything every day, what they're doing. That was not existent when I first started 12 years ago. And then it came on, and now there's very few that use paper MAR. So for us personally, we have
You know
to
what MAR
manage
stands for?
medication
Medication record.
I was going to say, anytime there's an acronym in healthcare,
Yeah.
Please tell me.
electronic medical administration records,
Yes.
medication administration records, EMAR.
Right.
EMAR.
So 12 years ago, still on paper. And there's some places that still use paper.
Yes.
Oh, yeah. Probably
Yes.
20% that are still using
Yes.
paper.
Healthy or not healthy paper documentation.
Not healthy.
I don't think so either.
Yeah, I got my...
You do?
Yeah.
He's got you got notebooks in the
So
car.
here's the thing: is that I why I say healthy or not healthy is because we manage those electronic MAR systems as a pharmacy. So that has added something that is really, it is our area of expertise to manage the residents' profiles, but now we do it for everything that they do. And it's like we've become a lot of our pharmacy tasks is to manage these medication profiles instead of just focus on their medications.
Somebody said this the first half. I forgot the numbers. Number of residents or facilities you work with was 120-ish or 100?
Yes. For community.
5,600. That's so you've
Patients,
grown
residents.
6 times since you've been here. What do you, if you 20 years from now, is this something that will continue to grow 6x every 10 years?
I hope so.
It definitely could. I mean, there's a lot of adult population, that are aging and they're moving into communities that we serve.
What's the statistics in the United States? 10,000 people a day turn 65 and older.
Right.
Which is, golly, that's insane.
That's insane.
Yeah.
Yeah. And you see more and more every day. I mean, there's constant, and I think it may change too. I think the focus now has kind of gone to like independent living buildings and getting people younger and healthier in these really social environments. And so I think we've seen kind of the dynamic or the clientele change a little bit too. But I think there's a lot of focus on independent living and getting those residents in earlier as well.
So we talk about all things healthcare, community, business, and life. I think community is really underrated, and that's what a lot of these places are, communities, right? So you want to age comfortably, you want to be in a social environment. You think it's oversaturated? I feel like there's a place popping up on every corner, at least in the state of Florida.
Right.
Yes, Florida, very much so. It's a hub. People want to retire here, and there's more and more people moving here every day. I don't know that it's I don't know that I would say it's oversaturated because I do think that they're busy and they don't have enough staff. Staffing is a huge concern everywhere, especially in this senior living market. So there's enough to go around.
I could see you were ready to say something there too. I agree. When I say they're all full, right?
Full.
Some of them have waiting lists. Maybe they all do. The biggest flaw for the locations is probably staff.
Right. 100%.
Agreed.
Yeah.
Why is that?
I think because of the oversaturation, honestly, of the population and the amount of buildings that is going up, I guess there's just not enough in our work environment. Most people don't want to go physically into a job now. A lot of people work from home, as I've heard some people even here.
Most of our staff, yeah.
But especially in this new population, Gen Z, they don't want to work at a place. They want to work from home. So I think it's a challenge to get people physically to jobs now.
Up.
Right.
That's tough to figure out too, because everyone talks about AI replacing jobs. These jobs are not replaceable by, at least not the touching residents.
Right.
Sounds
That
freaky.
human interaction.
I think where it's going to go, and because I just have heard this is going on, and is that you're going to have a robot that honestly wheels up to you, it recognizes your face, it dispenses the medications out, and it watches as you take these medications, and it's going to know. I mean, we know our phones can say like, yes, you've swallowed, yes, they've not. And it's going to tell you if you swallow the medication. I think that's where it's going to go in 20 years because of staffing challenges. But it also almost guarantees that, like, unless that robot goes down, it's watching that person, making sure it's the right person taking the meds.
So Guardian Pharmacy too, med management. How much do you have someone on staff that's coming in like, hey, you haven't filled your Lasix in a month? Who's managing the medications? Is that a combination of the entire team?
So
Yes.
honestly, one of the things of my team is we do a lot of med management. We make sure that medications, especially ones that are delivered routinely, are continually be taken because we deliver them and we see if they have a lot of excess, then that's something
They can see if there's 15 pills left at the end of the month. They clearly didn't take them.
So we'll record that and we'll give it to the director of nursing and we'll say, hey, you had a lot of excess medications this month. and then read between the lines. A lot of times it's funny is like their initial reaction is like they don't blame themselves or their staff. They're like, why are you bringing so many meds? And it's like, we bring as much as, like, you get the same amount every month. And then when you kind of break it down for them, they're like, if I gave you 30 days of a medication and in 30 days when I come back, you have 15 left, like, what does that mean to you?
Let me do the math.
And then, then it's like, and so that's something that we help as a team manage, and just bring that to the awareness of the director of nursing.
Well, and then they can go research because there are reasons why.
Right.
You know, the patient had to go to the hospital. You know, they were out for a bit. They went to rehab and they're coming back. So there's definitely reasons for that. They were at a doctor's appointment and they missed the medication. So it's not saying anything bad happens. It's just bringing awareness to
Understanding.
them.
It goes back to the communication too.
Yes. Right. And they're busy. I mean, those directors of nursing, they have huge jobs. So I think that's where the teamwork and the efficiency really comes into play, is just having the extra set of eyes from us too. They, you know, they're so involved and they're so aware, but just having that.
How many employees are with Guardian Pharmacy in Northeast Florida? Like, I'm trying to understand the size of this organization. It's nationwide, but Northeast Florida, like, how many people work for Guardian Pharmacy?
For Jacksonville, there's about 70 people.
70 employees in Jacksonville.
Right.
Company-wide, what's that look like?
Well, company-wide, I think we're
700 maybe.
No.
7,000.
I think like
8,000,
3,000,
9,000.
I don't know. I honestly don't know.
Is each location functioning completely independent of the next, or are you all part of one mothership?
So I think that's what's unique about us. We have a corporate support office in Atlanta, and they do a lot of the financial backing, invest in technology resources for us. And then honestly, each pharmacy's got local entrepreneurs that go out into the market, and we, sell to the communities. We provide excellent service and kind of win our markets over. And so we don't operate separately, but we are independent. But we offer a lot of the
worlds, I always like to say.
Yeah.
You know, we get to make the decisions and operate like a local.
You function autonomously per market, right?
Yes.
But you have the support and backing of a corporate headquarters for probably the stuff that you don't love doing anyway.
Yes, HR, legal, you know.
Well, they take a lot off of what you'd have to do every day to run a business, which you're familiar with.
A little bit.
And then, so payroll, auto insurance, health insurance, things like that get bumped up to
allow us to focus on what we should be focusing on.
You should put the corporate in touch with 212 Benefits. I don't know if you've heard of them, but they do employee benefits.
I was thinking about that.
We will now.
So let's talk about outcomes. That's probably the most important metric, right? Is improving outcomes.
Absolutely.
Can you elaborate on what an improved outcome is? I think the number one is decreasing falls is a big one.
Yes.
And decreasing hospital readmissions or admissions.
Yes. I think in general, I mean, obviously keeping those residents in their home, which would be these communities that we're talking about, is the number one priority for the family members, for the communities. And so anything that we can do to help keep them healthy and keep them home, not go out to the hospital, we're going to try to do. And I think we have some really great tools that I know Khristy would love to talk about. So I'm going to let her talk about one of them that we're really excited about.
So you mentioned Falls. That's a new tool that we have for communities to use. It launched in July of this year, and it just helps kind of give a visual dashboard for residents that might be at risk of falls due to their medications. And then the communities can go in, they can take a look at it. Our pharmacists partner with them to give a medication review and recommendations. So then we're working with the prescribers maybe to change regimens for them and reduce that fall risk based on their medications.
That matters. Falls are, I would say, one of the leading causes of hospital admissions for that age group, right? Are you ever working on, mine is if someone's taking 15, 20 medications, do you try to work with them to decrease the number of medications they're taking?
Sure. We have pharmacists that our consultants will go in and they do it regularly, especially with our skilled facilities. They do it monthly, where they're looking through their entire drug profile, medication profile, and then they're decreasing things that they don't think they should be on, or duplicate therapies, like you mentioned earlier, or things that might have a high fall risk.
I thought you were on the mic.
Khristy, she's more of the pharmacist, so
Well, I mean, a good example, as needed medications. If they have something that they're just taking as needed and they haven't taken it in 2 months, let's just not
Eliminate
have that medication.
PRN.
right.
Right.
Pern.
Yes.
That doesn't even make sense. Okay, Trevor Lawrence, how's it going to look this year? I had to ask. What are your thoughts?
I'm praying great. I think he's going to be. He has the tools to be great. So let's pray that he does great.
What are you going to add to it?
Oh no, bags.
Bags.
Sorry, we have a term
I
called
make
bags.
these videos where I put eye bag things and basically poke. I call them last year we called them the Jacksonville bag wires. I love the
Oh
Jaguars.
my gosh, that's amazing.
Huge Jags fan. But again, this is the last thing we'll say about football. This is it. Like
Right.
this year,
100%.
you got to prove
gotta make
yourself.
it.
And
We gotta
incredible
make it.
human. I think he's incredibly talented.
Great guy.
Not just his fault, but come on, guys,
know.
please.
Yeah.
Oh, I heard on Pardon My Take, they said to him, do you know that a Super Bowl has never won with a quarterback with even shaggy hair, let alone long hair? And they said, what does that mean to you? And he's like, well, I'm going to be the first to do it. And I was like, in my head, I'm like, no, shave
Cut your hair.
shave
Cut your hair.
Shave it immediately.
Shave it immediately.
Grow a beard.
His hair is so great.
So, yeah. Oh my God.
I said every girl listening, but his hair is great. And every guy's like, shave that head.
So Guardian Pharmacy, right? The Northeast Jacksonville location. Culturally, what do you do for fun? Do you go to Jags games? Do you obviously celebrating 20 years?
Yes.
But what are we doing as an organization?
I was just going to say, I think culture-wise, culture is really, really important to us. And I think every year we, as a leadership team, try to talk about different things we want to focus on. And we really try to give everybody the leadership to kind of discuss what they want that to look like. So the directors meet and then the supervisors also meet regularly. They do that to just talk about different things that are going on in the pharmacy, whether things that are going really well or processes that maybe we need to reconsider. It's constantly changing our market. So I think just maintaining that communication of what's working for one department, not for the other, is really important. When they do that, though, they also kind of talk about different culture projects or things that they want to see. We're really big on holidays and theme days. So there's usually weeks where we'll do, Jersey Day or Pajama Day or dress like your coworker day, which is very funny, by the way.
Except Jerry.
Jerry.
Jerry's not wearing.
Yeah.
He's wearing full suit and tie every day.
I will. No,
Jersey
I'll
Day.
dress up with the rest of them, but then it's like underneath. It's like almost like Superman.
He's got to
I'm
rip
gonna
off
have,
the
like-
cape and go to
like
work.
I'll tear off the costume
Yeah.
to have this underneath.
Yeah,
You'll wear the Superman stuff on top and take it off and be Clark Kent underneath.
literally. He has done that. He
And
has
I was
done
going to
it.
add though. So culturally, I was like deemed the culture keeper. So because they voted me as the most positive person in the pharmacy, but it was because I go around to everybody in the mornings. I'm like sometimes overly happy.
If you're not a morning person, stay away from
Right.
Jerry.
And one of the things that we do is when new people come into Guardian, I actually take them around with me for a day. We call it like a field trip for them, and then they get to see the assisted livings, who they're servicing. Because like if you're in a fill tech, you don't know, you're filling medications, you don't
It's
ever
really
see the
important to know
population.
who you're serving.
Right, and it's kind of nice is a lot of times I'll bring them purposely to like a memory care unit or an individuals with disabilities unit so they can interact with them. Because I think it really hits home to them when they see interact with a person and they know this is why I'm doing this.
We have a term that gets thrown around. Go ahead, Trey. You got something?
It actually, yes, it has to do with in regards to employment with you guys. Let's say we wanted to climb the ladder similar to you. Is it just a 4-year degree to get on y'all's staff? Do you even need a degree? Do you take interns? What could that process be?
So I wish we took interns. My God, we used to take interns and it was really nice. But you don't need a degree to become a fill tech. You just need there's a pharmacy technician's license that they need. And then I would think to move up though, like into my role, I have a 4-year degree. In chemistry.
Nerd.
I'm kidding. Trying to be a pharmacist. And I think other than that, so at the base level for fill tech or data entry technician, they do not need degrees. But then moving up past then you would.
Yeah.
Awesome.
I'll be curious. Ozempic, Zepbound, those. Do you see those in that population or not really?
we do actually see a good amount of it.
A lot of it's for diabetes.
Right, but it's
Diabetes
actually, I was going to say it's
versus
actually
weight
for
loss.
The
What it's
initial-
meant for.
right.
Yeah.
It's
Right,
that's
yeah.
well, if anyone
Which was a struggle because for a while it was on shortage. So
Hard to
people
get.
who actually
Right.
needed it for their diabetes management couldn't because everybody
Interesting.
was
Right.
diverting it for weight
Any
loss.
other medication trends you're seeing? Like, wow, there seems to be an uptick in this or a downtick in this. That's tough to answer.
That is a tough question.
Because I feel like they're all kind of go through cycles. It's honestly the providers that you see. You'll see an uptick of a provider, which makes me in my head, I don't know if this is true, but I'm like, well, they definitely got a visit from Eliquis recently. Because you're like, wow, everybody's prescribed Eliquis in this building. Like, okay, well.
That's definitely the reality too.
right.
So you're agnostic to any medication. It's just if a patient needs this, we're going to fill it and deliver it. There's no specific medication you have partnerships with or anything like that.
No.
Okay, that's good to know. What about home settings? Do you ever work with individuals in a home setting, that high income, high net worth people that are like, you know what, I want to work with Guardian Pharmacy directly?
I wish.
Okay,
We get that. That's a very good question. We get it often. I get it from so many industry professionals who, work in the home health setting, that kind of, acquire about that. But we are just specifically licensed to service those that are within a building.
Yep.
So if it's, like we said, independent living, assisted living, skilled nursing, if there's a building that we're delivering to, we can. Individual homes, we haven't quite
also
gotten into, but
logistically-
who knows where the next 20 years will take us.
That's true.
I think one big reason people wouldn't, though, is so as a long-term care facility, we are licensed to only be able to send out 30 days of a medication at a time. Whereas if you're at home, you might be like, why don't I get 90 like I would from anywhere else?
Yes.
So
Got it.
So that's a good point that you just made. That would be good to mention. People ask a lot of times, what is a long-term care pharmacy, or why are you different? And that is one of the things that I do always mention to people. We, as a long-term care pharmacy, are held to different rules and regulations that we have to follow for safety measures. So they make that a rule and regulation. Our senior population, it's always changing. They may go to the doctor 10 days later and the doctor doesn't like that medication, wants to make a change for them. So doing that shorter dispensing of medication is more safe, more compliant.
and the more grim side is that the population is at the back nine of their golf.
The back three or four holes.
Maybe putting out.
If you're a golfer, they're walking to the clubhouse.
And so insurance wise, they're like, well, I don't want to pay for 3 months of an Eliquis when the resident might not last 3 months.
I'm looking. This is my least favorite time, when we start to run out of time.
No, let's do
Last
it again.
minute, I love shout outs. So hi mom, love you. But anyone, hey, love this organization, love this employee. Anyone you want to shout out to, thank you.
My team, I'll definitely shout out my team. Cameron, Dan, Chris, Nayeli, John. They're awesome. Petra.
They're awesome.
I have a great team. And then Khristy McClelland. She is one of the reasons why
stole
I've
my
stayed
shout
here.
out.
Stayed here for 12.
on.
And I would say this company, why it's successfully been for 20 years, is Khristy is
100%.
She said she's a unicorn.
I call her a mythical unicorn.
I love it.
It's true.
Yeah.
She's the nicest human being on the planet, and does. There's so many times where I'm just going to share these stories. Is that we've had employees where they couldn't get to work because their car ran out, and she would give them a car. And this has happened on multiple occasions, including myself, where I crashed my car within like the first week of me doing my new job. And then she was like, no problem, you're going to get and she gave me a Camry and was like, there's your car now. And it was, so she's done that for
She's the reason we're here for 20 years and the reason
Well,
we'll be
we
here
have
for
to
20
shout
years.
out to our team.
Yeah,
so
and our
everybody
team.
that's in the pharmacy, they do a great job taking care of the residents and the
Our
staff that
customers,
takes
our
care of them
residents,
every day.
yeah.
So they're fabulous.
People like you guys letting us come here. So
I
We
know.
love.
Thank you
it's
so
fun
much.
for us. It's fun for us. Well, Jessica Ross, Khristy McClelland, Jerry Talarico.
Right for
Did I
the
get it right
fourth
again?
time.
Great.
Got
love
it.
it.
Crushed it.
It's really nice. Even my son's baseball coach won't say our last name. He's always like, and now, like after the tournaments, they announce their name. He's like, and now, Finn.
End of sentence. I love single syllable last names. Guardian Pharmacy had a blast. Hopefully you come back. That's what the hell just happened.
Woo!